Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location at Metro Orthopedics and Sports Therapy in Silver Spring, Maryland, discussing concussion treatment and management and how you can tell if your child is suffering from a concussion and the latest treatment options that are available and effective in treating concussions with one of this area's top orthopedic and sports medicine specialists, Dr. James Gilbert, as well as one of this region's top athletic trainers, Zack Delgado. Zack Delgado is a certified athletic trainer and is the head of the concussion management program here at MOST. Mr. Delgado is the head athletic trainer for the DC United soccer team's youth academy as well. Welcome, Dr. Gilbert.
Welcome. Thank you for having me.
Oh, it's our pleasure to have you on our program today. You're very esteemed within your field, not only locally, but nationally. You're certainly the head team physician for the DC United Pro Soccer team, which so many of us are very familiar with, not to mention team physician for the U.S. national soccer team. And I wanted to begin by having you on and telling us exactly what is a concussion, because this is a hot topic that are being debated and discussed every day out there. A lot of folks are getting concussions. Some don't even know they have a concussion. So I wanted to have you on and begin by telling us what exactly is a concussion.
A concussion is a traumatic brain injury, which is oftentimes difficult to diagnose because we don't have any good radiological studies or blood work that we can get to make the diagnosis. So the diagnosis needs to be made by clinical exam, oftentimes by trainers or first responder physicians.
Yeah, and we're obviously all familiar with the fact that concussions have become more and more prevalent, whether it's through sports injuries, accidents, on-the-job issues, incidents that happen, and they've become very prevalent. And that's why we wanted to ask you, Doctor, because you and your organization here certainly are one of the leaders in this region, and you one of the leaders in the country within this field. And I wanted to ask you, what is new in the diagnosis of it as well as the management of concussions?
Well, the awareness and diagnosis of concussion is much better nowadays. I think that where we're making improvements is in the actual management of an athlete who has had a concussion. We're trying to improve on management is through education. We have trainers throughout the community who can actually help make the diagnosis and put athletes through a progressive return to play program. So we have them doing neurocognitive studies and eventually exertional tests to know when they're ready to go back and play. So most of the confusion isn't so much whether or not an athlete's had a concussion, but it's really when are they ready to go back and return to their sport.
You're absolutely right. When do they go back? When are they ready?
I wish there was a perfect easy answer to when an athlete can go back, but at this point it really takes multiple approaches and different providers contributing to determine when an athlete is ready.
Yes.
Here at MOST we have specialists who can perform that. Zack Delgado works with the concussion management team, and he's worked with DC United Soccer and US Soccer, and he's going to explain on how we manage our athletes with concussion.
Yeah, he's actually going to be joining us momentarily, but I have to ask you, because some examples of what you just mentioned a few moments ago. You look at, locally speaking, in this region, you look at Brian Roberts of the Orioles. He basically missed 6 months, the whole season, because of a concussion. You look at other players in the NFL and in baseball and other sports where they're back in 2 or 3 weeks from a concussion. So I'm sure it varies, as you just touched on, patient to patient, the severity of the concussion, and how they basically, how their body is when it comes to recovering and healing from that, being ready to go back and play.
Yeah, that's right. I mean, no two concussions are the same. The mechanisms can be entirely different. One can be just a little ding, one could be a significant impact, and they can have different outcomes. So, you know, I like to use the analogy of when your satellite dish goes out, and that, you know, that's kind of what happens to the brain when it sustains a concussion. The brain is kind of like jello. It gets jostled, and all the circuits in the grids just aren't really getting connected, and the processing is off. And so when everything gets back in alignment and functioning, you know, can be very variable. And
yes.
when sometimes, you know, the danger of getting someone back too soon before that process has occurred is that they're vulnerable to another second impact. So we have to have a coordinated program with multiple different providers helping athletes get back and return after concussions.
Yes, indeed. And on that note, I'd like to thank you for joining us in this interview and being a guest on our program.
Thank you for having me.
All right. We're now going to meet Zack Delgado, who's one of the athletic trainers here at Most, as well as he heads up the concussion management program here. Welcome, Zack.
Thank you.
It's our pleasure to have you on as well. I wanted to ask you if you can please tell us if there are varying degrees that are out there when it comes to concussions.
There has been different guidelines, in fact more than 40 guidelines that have been used in the past to grade concussions. We have one of the most popular is the CAN2 guideline, which grades concussions from 1 to 3. And this used to be used in relation to loss of consciousness and the amount of amnesia that a patient got as a result of a concussion. However, with the current research that we have and recommendation from professional organizations like the National Athletic Trainers Association, we try to stay away from grading concussions anymore, but treating concussions the same way.
Okay.
In the way that a concussion is a concussion, and that you put the protocol in place and try not to go into grading concussions like mild to, you know, moderate or severe concussion, but just treating each concussion the same way.
And that's where everything is now.
That's where we are now. In the past 8 to 10 years, there were all of these different guidelines. Today, we're trying just to base it on if you have a concussion, you have a concussion, and let's not put a grade on it.
Gotcha.
It's all important. It's all, you know, it's all severe. Let's treat them all the same way.
Oh, I think that's very interesting how things have evolved in that particular area of concussions.
Yeah.
Because you're absolutely right. For many years, you used to hear, oh, grade 1 or a grade 2.
Right.
But now it's more, if he or she has a concussion, somebody has one,
Exactly.
let's just treat it.
And some of those guidelines would allow patients to get back to sports, depending on the grading, but still,
Sure.
while being symptomatic and, you know, being in danger of making the concussion more severe than it is at the beginning because of the way the grading works.
That's right. Now, there are kids out there every day, recess, playing on sports teams and things along those lines, or after school with their friends, that periodically get concussions. And I wanted to ask you if you can describe for the parents out there that are watching, what are some of the common symptoms they should look for to see if their child has a concussion?
Well, the key things to look at in terms of signs and symptoms is a headache that is also related to or combined with a head injury, of course, dizziness,
Yes.
difficulty concentrating, difficulty remembering events, some changes in mood or personality. You know, other things could be nausea, balance problems, sensitivity to light and noise,
Yes.
an overall feeling of sluggishness, or, you know, you see your kid acting a little slower than he or she normally acts. Those would be the things to look into. If you happen to have the information that your kid also was involved in an accident where maybe he sustained a head injury or even a a violent shake to the body that might have caused a concussion.
Yes, and I would think that the same symptoms that you just described for kids would also apply for grown-ups generally.
Exactly, yeah.
A little slower mentally, a little different in certain areas, like you just said, it could end up being the result of having a concussion.
Definitely, yes.
Especially when, like you said, there was some trauma or some incident where the head
Exactly.
took a hit, unfortunately.
Exactly, yeah.
Now, how do you treat a concussion, Zach? What would you recommend for folks?
Well, that is a good question. We don't necessarily have a specific treatment. There is not a cure per se for a concussion, but what the recommendations that we follow is that when you suspect that somebody sustained a concussion, you remove that person from the activity that might have created. We deal with a lot of athletes here, so that involves removing the student athlete from the sport that they're participating in and seeking medical attention. And together with that would be the protocol of, when you confirm that you have a concussion, keeping that patient away from the sport, yes, sometime from school if needed, yes, until the symptoms subside. So yes, total physical rest, and in some instances cortical rest through academic rest until the symptoms go away.
Yes, and that goes back to the concussion management system, how to manage that concussion, and
right,
so we can truly get back to normal sooner than later,
exactly,
and get on with our regular lives.
Exactly.
Now, what would you say is the typical recovery time? And I put a disclaimer by that, and that disclaimer is, I know it varies from patient to patient, depending on the severity of the concussion, things along those lines. But in general terms, what can you give us an idea of what somebody's looking at generally?
Well, yeah, if you look at the CDC and the numbers that they handle, I would say that 90% of concussions will resolve within the first to second week. Okay. And then you have a small amount that could stay longer for months, even up to a year.
Yes, because you hear that sometimes out there.
Yeah, but the big majority of mild traumatic brain injuries would resolve within the first 2 weeks.
Well, that's certainly good to know. I didn't actually know that. I thought it would take a bit longer.
With the proper management,
yes,
should add.
Yes.
Yeah.
What should folks know as far as advice from you on how they can possibly prevent concussions from happening?
I think the main key is raising awareness in their community, getting more educated on the topic of concussion within their community, their kids, coaches and teachers. Not really so much you can do more so than awareness in terms of preventing concussion. I could add reinforcing the use of protective gear in the sports that allow them, like football or boxing or bicycle.
Sure.
Maybe reinforcing that aspect of the protective gear.
Sure.
But I would say that the key component would be raising awareness in the community and education.
Your practice provides a highly effective concussion management program here at Most, and I wanted to ask you if you can please tell us what the main objective is of this program.
Well, our main objective is to make concussion management available for as many people as possible in our community. We want to make sure that we give access to schools or local clubs to a medical provider that can effectively diagnose and manage a concussion. Especially a lot of schools in our area that don't have an athletic trainer on site, a lot of club sports. So our mission is to make sure that we can expand that service to as many people as possible in our area.
Now, and speaking of schools and these club teams, my niece actually is interested in playing in a club team. She plays locally for the county, and there's thousands and thousands of kids that play every day in these programs. What policies would you recommend to them as far as what they should have in place really for student safety when it comes to concussions and things along those lines?
There's actually a law that has been passed in the state of Maryland this past year where every student athlete in a public school should be participating in a concussion management program. either this program being provided by the school itself or by a second party like our clinic. So that would be the recommendation. The ideal situation would be that every student athlete is participating in a concussion management program in which they can be exposed to a cognitive test that can be used as a baseline,
Yes.
and then follow up with the medical attention needed to properly manage the concussion. And then again, a school should be mandating that every student athlete that sustains a concussion needs to be cleared by a medical provider before they can return to the school and play sports in the school.
Now, what are some of the components of your concussion management program over here for the viewers out there so they have an understanding?
Yeah, well, the first component of our concussion management program is a very important component. It's our cognitive baseline test. And it was created, it brings an objective piece of information to managing concussions that we didn't have years ago. We do this during preseason, or ideally before the athlete or patient participates in their specific sport. And that's the first step. If you suspect that somebody sustains a concussion, we bring him into the clinic and we put our management protocol in place, which involves the following. We have a physical examination, we have a concussion evaluation in which we do cranial nerve assessment, postural assessment, and we take a history of the concussion itself. Then together with that, we do a post-injury test, which is the exact same test that we do as a baseline, and we compare the scores of some of your brain functions with the baseline. So we have a baseline score of what your normal brain function should be, and then we compare this with the post-injury exam to see if there's any deficits or any differences.
Oh, very impressive, very thorough.
Very thorough, and that's the middle part. From them we go on to the two components that we need to move on. We need a post-injury baseline, a post-injury test, which is within the norm as compared to the baseline, together with a patient being totally asymptomatic.
Okay.
When we have that, we move to an exertional test to see if any symptoms come back, and then we put in place a gradual return to play protocol that takes about 4 days, in which we're increasing activity gradually, looking at any symptoms returning or not. When we complete the protocol, we finish with a final doctor visit in which we write a report and make our recommendations, and then the doctor has the last word in terms of allowing that person to get back to their sports.
Oh, that's a very thorough, no doubt about it, very thorough and complete concussion management program. You cover everything A through Z to make sure everything has been properly diagnosed and the right management system is recommended within your program. And it's so important, there's no doubt about it, the management of concussions. Because we all understand that we can get a concussion literally on just bumping our head or getting shaken up, like you said, or anything out there can cause it, but how one manages it really determines how quick you can get back to normal.
Right.
And that's why it's so important when there's an organization like yourselves here at Most, with you over here, Dr. Gilbert and the others, that really properly walk somebody through everything in the right manner and in a very effective manner, so we can get back to our normal lives, Zach.
Definitely. And when you look at the latest research, that's exactly what they're talking about. They're putting more importance in the management, in the proper management of a concussion as compared to the number of concussions.
Yes.
So they're saying you might get 3, 4, 5 concussions in the next 6 years. If they're properly managed, you will be okay.
Yes.
Versus a person that maybe sustains 1 or 2 concussions, they don't manage it the proper way. They're out there playing sport while still having symptoms and exacerbating everything.
That's right.
That's where you could be in a dangerous situation.
No, you're absolutely right, because nobody wants to fool around with things that are related to our head.
Exactly.
And you want to go to an organization with folks like yourselves that have one of the, I mean, you guys, you're with DC United. Dr. Gilbert is obviously the head team physician for DC United.
Right.
It's a pro soccer team we're talking about.
Right.
So you have so many satisfied patients throughout this region, and you have a very effective management system in place as far as for concussions go, and the program that you've described and educated with us with today here, Zach. And I really think it's very important, not only in helping us get better quicker, but also preventing concussions in the future
Yep.
from what we gain from your program. And on that note, I'd like to thank you for joining us and being a guest in our program, Zack. It was a pleasure having you. Very informative and helpful interview on a very hot topic that's affecting a lot of folks out there.
Yeah, well, thank you for having me, and thank you for